Welcome to episode 4 of Walk in Our Shoes, a podcast about working at CHEO during the COVID-19 pandemic. These are brief conversations between CHEO's president and CEO, Alex Munter, and various staff and medical staff. This episode is a conversation between Alex and Louise Taillefer. Almost 35 years ago, Louise, a certified pharmacy technician, joined CHEO. She has seen a lot of changes. 2 new wings of the hospital have been built, and funding for a new building, One Door for Care, has just been confirmed, which will support children and youth with complex care, special needs, and mental health challenges. I'll let Louise explain some of the other changes that she has seen.
So, July 7th, 1986, you remember the day?
Yes.
Tell me about that day.
Well, I got a call to come in for an interview, and one of my colleagues from the college, she said to me, there's a maternity leave, maybe you should apply. Anyway, so I got hired, and there was a typewriter that we used back then. The technology was so much different than what it is right now. It's amazing.
And so thinking back to 1986 then, so the hospital would have been about 10, 12 years old, right? The hospital opened in 1974. What else was different in terms of pharmacy, if you think then compared to now? Obviously, lots of the drugs, right?
But just the automation alone, the pharmacists did not go up to the units as much as they do now. It was mostly text, as well as the back then it was not automated. So the ward stock, so the nurses were doing a lot of their IV antibiotics preparation. So we provide them with a lot of word stock on the unit. Like every day there was a different unit where we would go, and then when we had this big cart we had to push around, it took hours to fill the word stock.
And at the time it was kind of 9 to 5, right?
It was 8 to 7, I believe, during the week, if I'm correct, and then it was 8 to 4 on the weekends.
And now?
Now we're open 24/7.
So that's a big change.
Huge.
Yeah. And so the pharmacy team, just describe the pharmacy team at CHEO, who's on it and how they work together and what people's jobs are.
Okay, so we have the director, we have the manager, and then we have the staff pharmacists, and also we have our specialty pharmacists like in critical care and oncology. So the pharmacists, obviously, they're your typical pharmacists. They're the ones that do the clinical evaluation, and they closely work with the physicians and the residents and all that stuff. Then as for myself, there's no assistant here. Every one of us are regulated or registered licensed professionals. So basically the technicians run the show in the main pharmacy. The pharmacists are on the units doing rounds and advising with the physicians, and the technicians were the ones that do the compounding, we do the medication history, we fill the prescriptions, oral, IV, prepare the chemotherapy. The only difference in oncology pharmacy, the pharmacist checks the chemo, versus in the main pharmacy, all the checking basically is done by the technicians.
You're part of the care team that helps kids and their families beat cancer.
Yes. Seeing the kids, meeting the parents when I have the chance. I mean, I spend a lot of my time preparing chemotherapy, but I do sometimes get the chance to do the medication history to help out the pharmacist. We do a lot of compoundings, and because we're a pediatric hospital, there's a lot of the medication that they take is not commercially available in the format they need. So we do a lot of the compounds. So now we also have more recipes, more data, more stability for the products that we can make so much more as well.
Can you talk a little bit about how the pandemic has changed your work in the pharmacy?
Definitely with the acquisition of medication. We had to stockpile a little bit or be very careful. So that was one of the items, and I think that's global anyways. PPE as well. So that's something that because I work in the oncology pharmacy satellite, I have to wear an N95 mask to do my work, not just a regular surgical mask. And then I have a special gown as well too, like chemo-proof sterile gown as well. So we try to manage not using just for an hour or two for somebody else to use a new gown, new PPE, gloves, and all that stuff.
Because we were at that point, not anymore, but at that point we were really worried about running out of PPE, right?
So that's one of the things. And then the other thing that COVID has brought, is having the pharmacy technician is to be trained to administer the COVID vaccine. So this is a new opportunity that came from COVID.
Right.
Yeah.
And you have volunteered to do that?
I've signed up.
Yeah.
I've signed up to be able to administer the COVID vaccine.
And why do you want to do that?
I think it's a great opportunity to help, because they'll be needing so much help with this big bash of wanting to vaccinate everybody. So this is one more skill set that adds to my portfolio. So that's really another reason why I want to do this.
I was thinking because, of course, in your satellite pharmacy, you've always had to use PPE. Like, PPE is not a new thing for you,
No.
like it is for maybe some people. You're kind of an old hand at PPE.
But even though I'm an old hand at it, I have to say, when I get home, I can't wait to take that mask off. Like, at my work, that's fine, but aside from work, it gets a little bit much.
Right.
We're all working hard. We've all been through a lot of changes, and our mission is to make sure that the medication is done in a safe way and in an expedited way as well, too. So we work very hard. We all work very hard to get that done.
One of the things about working at CHEO is, and you've illustrated it with your story, is just how much change. Everything's always changing. Mm-hmm. And so you need to be able to adapt and learn new skills. And so you've done that. You've really surfed the wave, right?
Mm-hmm.
Yeah. So congratulations and thank you for that.
Thank you. My pleasure.
This has been Walk in Our Shoes, a podcast about working at CHEO during the COVID-19 pandemic. If you think a career at CHEO, as a pharmacy technician or anything else, might be right for you, see the careers page at cheo.on.ca. CHEO is a global leader in pediatric healthcare and research. Based in Ottawa, CHEO includes a children's hospital, children's treatment centre, school and research institute, with satellite services throughout Eastern Ontario.